dilation of the esophagus is a therapy that's needed as well in this disease. You know, the inflammation, the eosinophils in the esophagus, we can treat those with medicine or diet. But once the eosinophils secrete the proteins and create this scar, which is fibrosis and narrowing of the esophagus, which causes it to narrow down, then that's not going to go away until we mechanically disrupt the scar. So patients may get a great response to medicine and still say, "Doc, I can't swallow." And that's because their esophagus is narrowed and we need to stretch it as well. We were worried about it originally about getting tears in the esophagus. Now, you frequently get a tear in the inner lining of the esophagus, which is part of the process to stretch this. That's not a big deal. If you get a tear through the wall, that's called a perforation. That is a serious illness. Now, that's uncommon. It's about 0.3% of the time. So 3 in 1,000 dilations that can end up with that. Now, the most likely cause of a perforation with eosinophilic esophagitis is related to food sticking and retching. So people that have a narrowed esophagus, we should stretch this, we should get it open. To have pain with a dilation is common. Usually the chest is a little sore in many of the patients for a few days. But the swallowing is usually much better. And we dilate this in stages. If it's very narrow, we may stretch it up a little bit at a time. And it may take 2 or 3 dilations to get up to full size. But clearly dilation is an important part of the armamentarium to treat eosinophilic esophagitis. Now, once we suppress the inflammation, hopefully we don't need to dilate in the future, and we've shown this. We found that patients that once we dilate them up and turn off the eosinophils, requirement for further dilation is extremely rare.